Hello everyone, I'm Javellana, and together with me is my partner, Maria Angelica Atillo, and today we are going to present about Autism Spectrum Disorder, or ASD. Autism is a type of neurodevelopmental disorder that is characterized by problems with communication and social interaction. People who has autism often demonstrate restricted, repetitive, or stereotyped of interest or behavior. The spectrum in autism spectrum disorder means that every child has his or her own unique combinations of characteristics. Actually, in the DSM-4, or the Diagnostic and Statistical Manual of Mental Disorders, 4th edition, there are disorders such as Asperger's syndrome and childhood disintegrative disorders that they describe as similar to autism. But when they revised the DSM-4 in 2013, they removed those disorders and put it or labeled it as autism spectrum disorder. They put every characteristics of those previous behavior in the DSM-4 in this spectrum, the autism spectrum disorder. Research suggests that autism is a combination of genetic and environmental influences. These influences that I'm going to present today appear to increase the risk of a child to develop autism. It's important to note that increased risk is different from cause. So, research tells us that autism tends to run in families. Also, changes in certain genes increase the risk that a child will develop autism. If a parent carries one or more of these gene changes, they may pass it to their child. Even if they don't have autism themselves, these particular genes that they have will increase the risk of a child to develop autism. Majority of these changes do not cause autism themselves. They simply increase the risk of the child having autism. Here are some influences that increases the risk of a child to have autism. First, having a sibling with ASD. Second, having an older parents or parental age. Third, having certain genetic conditions, which I've mentioned earlier. It says here that people with conditions such as Down syndrome and Rett syndrome are more likely than others to have ASD. And very low birth weight during conception. Today, we are going to learn more about autism spectrum disorder by learning about the referral process, and you are going to watch a role play of a practitioner telling a client about the disorder, or a practitioner breaking down the disorder to a client.
Today, I'm going to discuss about the referral process of a child who has an autism spectrum disorder. Let's break down the process, the referral process, into 4 parts. These are: first, the referral; second is the tool for assessment; and third is the assessment; fourth is the writing of findings and psychological report. First is the referral. For a parent who is concerned about the child, he or she may go to a psychologist and ask about the symptoms of her child. The psychologist should meet the parents and the child before the formal assessment in order to clarify the aspects of reasons for the referral. In order to have the right diagnosis of a child who has an ASD, we should interview the parents carefully and ask the right questions. So, as we all know, interview are one of the best way to know what is the concern of those certain people. So second is the tool for assessment. After the referral, the psychologist now chooses the right tool to be used and to know exactly what is the diagnosis of a child. An example of these tools are the MChat or the Modified Checklist for Autism in Toddlers. It is a parent report screening tool to assess the risk for autism spectrum disorder. The test is approximately 10 minutes. Parents should complete the 20 questions and receive an autism risk assessment for their children. The primary goal of MChat is to detect autism cases as possible. So another is the Autism Diagnostic Observation Schedule or the ADOS. The protocol consists of a series of structure and a semi-structured tasks that involve social interaction between the psychologist and the child. So let's came down to the third process. It is the formal assessment, whereas the child is going to be evaluated to know the official diagnosis. Then the fourth one is the writing of findings and the psychological report. Here is where the psychologist will write or her finding that is designed to assess the referral question of the patient. So here, it is where the psychologist will write the diagnosis and find the right intervention for the patient. Good afternoon ulit, ma'am. Ito po ang findings ng anak nyo based sa ginapakita niya po na symptoms and based sa ating test na pinakandak sa kanya, meron po siyang autism spectrum disorder. The autism po ay isang kondisyon na naapektuhan ang communication at interaction ng isang bata sa mga taong nakapalibot sa kanya. Meron din po siyang repetitive behavior na pasok din po sa anak nyo. Ang autism po ay isang kondisyon na hindi natin dapat ikabahala. Ito po ay kondisyon na hindi po nawawala, pero may mga solusyon po tayo para sa pag-manage ang anak nyo. Ito po ay ang therapy kung saan we can use the occupational therapy. In here, it teaches skills that help the person live as independently as possible. So, skills may included the paano sila dumamit, paano kumain, paano maligo, and relating to people. So, another is the social skills training. So, sa social skills training, tinuturuan po ang bata kung paano mag-interact sa kanyang kapwa, including po yung mga conversation, yung problem solving, and many more. At saka meron din po tayong speech therapy, kung saan tinutulungan po nito ang isang taong merong ASD to communication skills. Some people are able to learn verbal communication skills. For others naman po ay ginagamit nila is gesture, picture boards, is more realistic. So, wag po kayong mag-alala. Madami pong seminar mga magulang kung saan tinuturuan kayo paano mag-manage ng anak na may autism. Bibigyan po kayo ng brochure sa mga seminar na ito. Kailangan po nating maging educated sa mga bagay na ito ay kailangan din nating turuan ang ibang tao.